This week, we want to talk about the concept of exercising to induce labour, as we're sure you're ready to leave your pregnancy days behind you. Your body and your baby will be ready when the time is right, but unfortunately there is no guaranteed method that will induce labour in the next 24 hours. But that doesn't mean you can't try things to help pass the time and stay active while you're at it. We're going to talk about what natural labour induction involves, why exercise can help, and then we'll show you some exercises and stretches you can use to nudge the process along. So let's begin by looking at the 4 things that need to happen prior to birth. Firstly, relaxin needs to go to work. By now you're very familiar with relaxin at this point, and prior to birth this hormone needs to kick in and loosen your hip ligaments even more, so that there is enough space for your baby to pass through. Secondly, your cervix needs to ripen. So the cervix is the opening to your uterus, and these tissues need to soften, thin out, which is a process called ripening. This allows for the dilation of the cervix, which allows the baby to leave the uterus and enter the birth canal. Number 3, your baby needs to engage. This is when your baby's head descends deeper into your pelvis to get in the position for birth. For many first-time moms, this happens a few weeks before labour begins. If it did happen, you probably noticed it as a feeling of relief as your baby stopped pressing up on your stomach and your lungs. However, it also comes with a bit of additional pain as baby is now putting more pressure on your hips and pelvic floor muscles. If this is your 2nd or 3rd pregnancy, engagement may not happen until you're actually in labour, but nonetheless it is a crucial step before the birth. And lastly, your waters need to break. Prior to this, you'll pass a mucus plug which has been inside the cervix from the start of pregnancy in order to prevent bacteria from reaching the uterus. It will look like a sticky discharge, though you've likely passed at this point. But let's talk about your water breaking. This is when membranes of the amniotic sac rupture, and the rush of water that you'll experience is actually the amniotic fluid that has been surrounding your baby. After these things happen, contractions can start at any point. They'll function to further dilate your cervix and push the baby out of the uterus and into the birth canal. We're sure you're ready for this to happen by now, and that's why we want to help you to use some natural methods of induction while you wait. In your next video, we'll show exactly what exercises you can use to encourage hip opening, cervix ripening and engagement. But before we do that, it's good to know the other ways that exercise can help in these final few days. Firstly, it'll keep you occupied. We know that you only have one thing on your mind right now, but the more you can direct your focus elsewhere, the better. A gentle yoga routine or a few walks around the block with a friend will help pass the time. Secondly, it'll prepare you for the birth. A little bit of stair climbing or even a 15-minute walk will elevate your heart rate enough to keep you in shape and ready for the big day. You'll need a lot of stamina when the time comes, and staying as active as possible is the best way to help with that. Thirdly, it will keep your mood up and your stress down. Staying positive and relaxed right now is so important, as your psychological state plays a key role in the labour process. Exercise is a natural mood booster, so go out and enjoy those endorphins. The best thing you can do over the coming days is to combine light activity with safe stretching to encourage induction and keep you prepared for labour. We promise your time will come.